Today we're out at the Baton Rouge Police Department headquarters for National Prescription Drug Take Back Day. This is an annual event. It's sponsored by the DEA, the Drug Enforcement Administration, but we have all the other local law enforcement agencies here today. We have the state police, Baton Rouge PD, we have the fire department, we have sheriff's department, we have everybody you can think of out here to kind of show that we're all together in this desire to get old, expired, unused prescription drugs off the street, out of our medicine cabinets, and safely dispose of them. So this event is something that happens every year. There are collection sites all over the nation, but we've chosen to pick one of these collection sites and really support it, kind of make a health fair out of it, bring people out here and encourage them to bring their old prescription drugs so that we can take care of them. It's very important for people to dispose of their old prescription drugs properly because it's a safety issue. If you leave, for example, if you have an old Vicodin prescription that you got from the dentist after having some dental work done, and you just haven't finished it, but you stick it in the medicine cabinet and you forget about it. Unfortunately, there's a lot of bad things that can happen with it. Somebody might take it accidentally. Teenagers who abuse prescription drugs often get them from their own medicine cabinets at home or their friends' medicine cabinets. And last but not least, you might have elderly people or even pets who go in the trash and accidentally, get hold of pills. So the best way to get rid of those pills is to bring them to us and have them safely incinerated by people who know what they're doing. Don't throw them away. Don't flush them down the toilet. There's all kind of bad stuff that happens with that. We just want you to make your home safer, your loved ones safer, and make our community safer as well.
The opioid epidemic is growing across the country right now, and so this is a good way for the community to come together and kind of do their part, to try and keep prescription drugs, out of the hands of maybe people that shouldn't have them, or doing their part to keep people safe.
Blue Cross has actually been involved in this event since the very first one. We got involved because we're very concerned about health safety and public health, and prescription and drug safety is a big part of that. For example, the opioid epidemic is now just, getting bigger and bigger across the country and in Louisiana. Here in Louisiana, our rate of opioid overdoses is higher than the national average. And as far as prescriptions themselves, there is more than one prescription in Louisiana for every resident in the state. So it's really gotten just indescribable how bad it's getting. And, as the largest health insurer in the state, and as an insurance company that's very community minded, I think everybody knows that. We're trying to do our part to address that, and we have several different things we're doing, but this is a big thing that we do with all of these partners.
Brought in drugs from my brother-in-law and my wife and myself that we've had piled up for quite some time, and glad to see this program take place.
What do you think of this operation here?
Oh, I like it. I'm glad to see this. So I hope a lot of people participate in it.
What's the advantage of disposing them this way as opposed to others?
Well, if they go down the sewer, they end up in the wrong place. The fish get them, or it goes downstream, or they throw them in the trash and it contaminates a lot of stuff.
Unfortunately, my father just passed away not too long ago when we were holding on to his prescriptions and didn't really know what to do with them. So this was a great opportunity to dispose of them safely.
Why do you think that's important?
Well, we really didn't know what to do with them. We knew it wasn't a good idea to flush them or just to kind of have them sit around. So it was perfect timing.
Kind of a collection of different medicines that we had accumulated. During the time I was injured one time by an automobile hit me in Shreveport, and I was in therapy and so forth, things like that, and I accumulated a lot of medication, and not to mention my doctors made a lot of prescriptions I could not use.
So why'd you bring them out here today?
Well, I saw the advertisement in the paper. I've had them accumulated for years and just stored it away, and this was a good opportunity to bring it out here and get rid of it.
I had several medications that were my mom's that she no longer needed, and our church used to collect them as well. So we had quite a collection going, and I took them by St. Vincent de Paul and found out about this happening today, and it was perfect because that was just this week. I went, well, that works for me, and I just live right across the airline, so pretty convenient.
Here to donate used prescription drugs. A lot of stuff got destroyed during the 2016 flood, and these are stuff that we found left over in the house.
Why do you think it's important to dispose of it this way as opposed to other ways?
Well, other ways is flushing it down different ways, like flushing down the toilet and different things is harmful to our planet and substance systems, and it's unsafe for kids to be able to get a hold of, and it's the best way possible to get rid of them that I know of.
I wanted to get rid of some drugs that were taking up space in my medicine cabinet, and I no longer take the drugs, and so I wanted to get rid of them.
Why did you pick this place to bring them?
Most convenient place for me to get to.
We just had some things in the house that we needed to get rid of, and we didn't want them to end up in the wrong hands, and we felt like this was a worthwhile cause, and we're very glad that they're doing it today.
What did you bring here today?
Prescription medications that expired. They've been over a year old, and we just weren't comfortable having them in the house anymore.
Came out here to dispose of some unneeded drugs from my recently deceased father and some medicines that my wife had had.
How many did you bring out?
2 plastic bags full. I didn't count them.
What do you think of an operation like this?
I think it's good. Keeps them out of the wrong hands and keeps them off the environment, as my wife says.
One thing that we're really excited about this year with the Prescription Drug Take Back Day event is the fact that we've had so many new partners join us. And that's in addition to all the law enforcement agencies that have gotten involved. We've also had the Women's Hospital, Our Lady of the Lake, and the Baton Rouge General come and join with us. They've set up booths here. You can get free health screenings. You can get information on all the things they do. So they've partnered with us on this overall mission of improving health in Baton Rouge and hopefully spreading the word across the state.
Oh, it was very interesting. I didn't expect this. They actually have people testing sugar and your blood pressure, and I was interested in the blood pressure, and so very friendly. Not only did she take it, mine just happens to run low, so she was giving me a lot of helpful information as to what I could do to help bring it up a little bit. It was very interesting, very friendly, nice group of people.
Blue Cross's mission is to improve the health and lives of Louisianians, and we do that in all kinds of ways. This is one example. We also work to give grants and sponsorships to organizations across the state that help improve people's health, like the American Heart Association, the American Cancer Society, the Arthritis Foundation is another example. And what these groups do is very close to what our mission is, and so we support that. And we do a lot of education, and this day, the National Prescription Drug Take Back Day, is also a good example of that, because we're giving everybody that comes by educational materials about drug safety, about how to keep kids away from drugs and things like that. So this event really goes right to the heart of our mission.
Your reaction to everything that you've seen and heard here today?
What I have seen and heard here today has already been fantastic. We're not even halfway through at this point where I'm talking to you, and we've had so many people come by already. We've had people with a garbage bag full of pills who have come and dropped those off, and all those pills are getting out of houses, they're getting out of kids' reach. It's really exciting. And people are also getting health screenings out here. Their kids are getting to see the AirMed helicopter, the ambulance, the fire truck, and that really lets kids know that law enforcement are friends to them and are all about safety and protecting them. So that's another really great adjunct to this event.
This has been great. We've had a great turnout so far here today. We're still going to be out here until 2 o'clock at BRPD headquarters. We've had a lot of people come in and out. BRPD, Blue Cross, everybody has tried to make this a community event, so there are other health initiatives here as well.
What are the dangers of people keeping these drugs in their homes?
You run the risk of, kids getting into, curious kids going into medicine cabinets, potential addiction, sickness, overdose, and even death. So you just, either take your medicine or dispose of it properly.
Oh, I think it's great. I'm a big fan of Blue Cross. So.
Very appreciative of Blue Cross's help, and I'm very glad they're involved.
Well, I think it's wonderful if they're going to get the word out about the prescriptions and how it can be dangerous if people are taking them expired or taking medications they shouldn't take.
I think Blue Cross is an awesome organization.
I think it's a good thing for them to be involved with. I think it's very helpful for the community, and it helps get things off the street.
If people have questions like more information, what should they do?
If people have more questions, they can do a number of different things. Blue Cross has a page about drug safety on our website. It's bcbsla.com/safe drug drop. They can find out other ways to get rid of their prescriptions safely and just generally more about the event. They can also go to DEA.gov to learn more about all the DEA's activities.